want to touch upon the topic of mental health in times of uncertainty and fear, and specifically under the scope of something we are all hyper fixated on globally, that being COVID 19, obviously. However, I want to go beyond the symptoms, prevention of spread, and toilet paper memes we are seeing on a daily basis. I want to delve into the mental health effects of the COVID 19 pandemic and how it is contributing to greater reports of anxiety and depression among global citizens, and how this decrease in mental health is attributing to rapid increases in suicide rates globally. Our government officials have implemented stay-at-home orders, educated the public on how the virus spreads, not to gather in numbers, to wear masks when leaving the house only for the essential needs, the importance of washing your hands for prevention of spread and protection of your family, and have created new cost-effective and efficient ways of testing. These things have evidently been positive implementations towards the prevention of COVID 19. They've protected the public, and now there are new, lower projections of infected from the Institute for Health Metrics. However, it remains that COVID 19 is a traumatic event for all citizens of the United States, and despite these improvements and projections, according to the Institute for Health Metrics and Evaluations, we still have a shortage of 8,000 ICU beds, and families have lost loved ones, jobs, and their sense of security. Because of the stay-at-home orders and social distancing, many employers have laid their employees off without a confirmed date of re-entry. Many Americans fear for losing their job during this time, and many are facing severe financial strain attributing to the national economic depression. Unemployment rates have skyrocketed. According to ABC News, as of April 9th, in just 3 weeks, more than 16 million Americans have filed weekly jobless claims. This doesn't include the number of individuals who haven't been able to file for unemployment due to inability to get a hold of unemployment centers and the high demand of calls. There have been so many claims that the government is now struggling to manage to send out weekly claim payments to all applicants. Education of people of all ages has been derailed, leaving high school and college graduates without the chance to finish their degrees and attend commencement on campus. And parents are struggling to maintain their children's competency and education through online learning at home. Healthcare workers struggle to effectively and safely care for their patients due to high nurse-to-patient ratios and national shortage of PPE, beds, and supplies. And essential workers stress about contracting the virus themselves, bringing it home to their families, and many of them are choosing to live apart from their children and loved ones for an unforeseeable amount of time. These implications of the virus, amongst many others, such as a decrease in access to health care and increase in public crime rates, has led to a general sense of uncertainty, stress, and fear that has encapsulated the people of America. It is understandable how these emotions have led to increased reports of depression, anxiety, and suicide. And according to the Mental Health America, we experienced a 19% increase in screening for clinical anxiety in the first weeks of February, and a 12% increase in the first 2 weeks of March. There has been an increase in the number of domestic violence, child abuse, substance abuse, relapse, and suicide rates as well. Glenn Sullivan with Psychology Today states that suicide rates often have a correlation with unemployment rates, and that as a result, 2021 could see more than 54,000 deaths by suicide versus 48,000 in 2018, meaning the excess 6,000 deaths would be in correlation to the unemployment and economic impacts of COVID-19. With this in mind, I conclude we are all in this together. This is me. I'm Miranda Habig, a frontline COVID-19 nurse at Mercy Health West. I, like everyone, am scared. I am uncertain. I have experienced more anxiety in the past 2 weeks than I have in my entire life, but I am not alone. If you are feeling the effects of COVID-19 on your mental health, please reach out. I urge you. Organizations such as Mental Health America have posted a multitude of resources and information to aid individuals and communities during this time. And as WHO recommends, there are benefits for helping each other. These are the times to call your friends, your neighbors, your family, check in on them. Not only will it benefit them, but it will do wonders to lift your spirits as well, because working together as one community can help to create solidarity in addressing COVID-19. Thank you.